Today I am here with Dr. Furmli. Dr. Furmli, can you please tell us a little bit more about yourself?
Absolutely. So my name is Dr. Suleiman Furmli, and I'm a panel physician with the IRCC, and I help conduct immigration medical exams on behalf of the IRCC. I've been doing it for about 4 or 5 years, and my clinic is in Ajax, which is in eastern part of, I guess mid to eastern part of the GTA. And that's one of my main full-time roles right now.
And what is an immigration medical exam?
So an immigration medical exam, or an IME, it's a standardized exam that most migrants and visitors to Canada are required to do as part of their immigration process. It looks for certain things, which we can get into later. And it's and many other countries do this as well. So Canada does it, USA, UK, Australia, New Zealand. So many countries usually conduct a medical exam for people who are going to be residing there. And most of the information actually that we'll be talking about today is also freely available online and the panel physician handbook as well. So it's a very transparent, the IME or the immigration medical exam is a very transparent sort of medical exam, if you could call it that.
And why are the immigration exams conducted?
So there's two main functions of the IME or the immigration medical exam. The first one is to help protect and limit the spread of diseases that are coming into the country. So to protect Canadians from infectious diseases like tuberculosis, HIV, syphilis, hepatitis, things like that. So many times someone may or may not even know that they have it until they're tested. And so by us testing it when they're either before they come to Canada or when they're in Canada, it allows us to be able to identify it and then treat them for it, because a lot of these infectious diseases are easily treatable. So we've had many cases where a loved one has, let's say, a disease like tuberculosis, and they're living with their extended family here. And so by identifying that they had tuberculosis, we were able to get them the treatment and prevent them from actually spreading it to the rest of the household and from the greater Canadian population. So that's the first one, is really identifying and treating diseases that could be spread to other Canadians. And the second reason why the immigration medical exam is conducted is to just make sure that it also protects our Canadian healthcare system, so that if there are any migrants or visitors here that might have a disease that might put a great burden on the Canadian healthcare system. So for example, let's say someone needs a kidney transplant, or they need extensive cancer therapy, and the transplant waiting list is already very long for Canadians that are already living here. So out of fairness, they'll look and screen for certain diseases like that might have a big price tag to them. It's called excessive demand, and assess for that as well. And I think the amount that they actually is actually an amount listed, which is around $120,000 or more would be the cost of whatever that illness might be over 5 years.
Would that prevent someone from getting entry into the country? Like, for example, if they did need like kidney transplant, would that prevent them from getting into the country? Like, would that be
it wouldn't be the only factor. So the main thing is that and it wouldn't even be me who decides anyway. I'm just there to kind of like, as a panel physician, our job is just to screen and do the exams. But there is more sort of higher up decision makers within the IRCC who will make actual decisions if someone passes or if an applicant is accepted or rejected based on medical grounds. But having said that, I actually had a case like this where I had a young gentleman, and he actually had no idea that his kidneys were failing him, and what he decided to do was actually to go back then to his country of origin, where he was actually able to get a kidney transplant, and he was able to get all the medical care he needed, and then he came back after, which to his benefit actually, because to get a organ like that, like a kidney, the wait list here would have been very long anyway, and it would have cost him a lot out of pocket as well. So he was actually able to take care of all those things and then come back and then reapply and then eventually gain admission. So it's not like black and white, like if you have this. And I've had, like, for example, many other cases where, let's say someone has a grandparent or someone who actually has significant medical issues that's living abroad, and they'll sponsor them here, but as long as they can prove that they can look after them well without them needing to use the publicly funded healthcare system,
Right.
then they might be able to still be granted admission and have their application and file go through.
So you mentioned earlier that you've been doing this since like 2020. What was the process like during COVID times? What has it changed to, and what do you think it's going to be like going forward?
So so COVID was an interesting time because at the very beginning of COVID, most places were shut down, including like most of our clinics, and it was actually advised by the government that like not all non-essential medical services be suspended. And so for a few months, I think we were probably more or less closed or shut down. But then what happened was at some point, because we had a lot of migrants already in Canada, and because they were kind of in a way sort of stranded here because there was a lot of lockdowns and travel was cut. So the government made the decision to suddenly sort of increase the immigration numbers or the invitations to get permanent residency or status here from all of those who were already here. And so then we saw a big rise in the number. So it became actually like probably the busiest time that I've ever seen during this sort of maybe about 6 months to a year into COVID. And then after about 6 months, it kind of stabilized, and now it's kind of sort of steady. And I'm not sure how busy things will be moving forward, but recently it looks like the government is trying to limit some aspects of immigration, like student visas and things like that. So I guess it'll be hard to tell right now, but it looks like right now the government is trying to cut things down because of like living costs and things like that.
Do you think that'll affect your practice in like a really, really big way?
I think it will probably slow things down. And I don't know if it would do it in a significant way, but I guess it'll be seen, because no matter what, there will always be some level of visitors, refugees, and other migrants. So maybe it could be that they might just be coming from different pathways, but the numbers may be more or less the same. At least I would hope so. But if not, I mean, there's a lot of other different services to offer, in a medical office. And there's no shortage of patients here, so I'm not too worried about that.
Yeah. What should people bring to this exam?
There's not a lot that people need to bring. The most important thing is really their passport, and if they don't have a passport, then any other photo ID. The second thing would be if they have any immigration invitation to do their medical exam, to bring that with them too, because usually there'll be an IME or immigration medical exam number that's associated with it, so that we can connect their file. Besides that, like, we do a vision test, so if they wear glasses for distance, we ask them to bring their glasses.
So you do a vision test, so it's like everything.
Yeah, it's a pretty comprehensive physical exam, so we do ask them to bring their glasses. If anyone's taking any prescription medications, we ask them to bring their medications with them, so that we can log those down. If they have any consultation reports from physicians from other medical needs they've had, like let's say heart surgery or cancer treatment or tuberculosis treatment or something like that, we ask them to bring those reports with them as well, if that applies. Other than that, we do a urine test as well, so we just ask the applicants coming to drink some water before they come, so that usually helps, and that's really pretty much it.
Great. And what's a common misconception that people have about the entire exam process?
I think the biggest misconception that I've noticed from a lot of our patients that come are really that they do feel like, even though we are doing a comprehensive sort of exam, like checking vision and blood pressure and these kind of things, I think the biggest misconception is what we test in the blood test. People think that we're kind of ordering a whole battery of tests, like diabetes and liver and cholesterol and things like that, whereas it's actually very limited. Like, we only check for 2 or 3 things majority of the time.
It's expensive too.
That's correct.
test for everything. Yeah.
Yeah, exactly. It's expensive, and I guess for based on the factors that what the IRCC and the Canadian government's looking for, it's very like limited things. So I guess whenever we finish an exam with someone, they always ask like, okay, well, when are we going to get the results? We really want to know. We're really curious to know, you know, what our sugar is, what our cholesterol is, and then I kind of step in and say, hey, you know what, like, you don't really need to, worry about those things, or that we're even testing for those things, because it's not even part of the exam. And so a lot of times they're pretty reassured.
Yeah, it's kind of funny that like they think that they're gonna fail, or I mean, it's not funny. Obviously, they want to, you know, come to Canada, but it's just that even just getting your body tested is also like a test in a way, and they want to see how well they did or how well they didn't do. But I feel like even just me, the misconception that I had is that if you are not healthy enough, then you can get rejected. But you mentioned earlier that it's like a certain number. Like if your healthcare issues don't exceed that certain number amount, like 120,000 you mentioned, then it's all like you're good to stay.
That's exactly right. Yeah. So yeah, that is true. So a lot of times I am offering that reassurance, because like you said, like there are a lot of hoops that people have to jump through with scores, and with their English scores and other CRS score and et cetera, et cetera. There's so many different hoops to jump through, and so definitely when they come for their health exam, I try to take a moment to reassure them and let them know what the true purpose of the exam is, so that they don't really need to feel that if their blood pressure is like 2 points over or
can't come to Canada.
Yeah, exactly, that it'll jeopardize their exam, and especially because things like blood pressure, even heart rate, those things do rise when you're nervous naturally, right? So even a lot of times when we notice a high-ish blood pressure, usually after we reassure them and they calm down, it goes back to normal a lot of the times. It's called white coat syndrome, so there's actually a name for it. So a lot of the exam is really just reassuring them that, look, we're only focused on these like certain things that are really important, and majority of the people are generally healthy. Like very few and far between are people that will meet that excessive demand issue, at least in my practice.
So what are some reasons that people fail the medical exam, and like how can people be better prepared for it?
So I guess there's not really a pass or fail with
I think it's just exam. Like you said, the number amount, or if they're too unhealthy, where it's like an excessive amount of unhealthy.
Yeah, if it meets the excessive demand requirements, and like I said, it's not just one thing either. The application will be looked at obviously as a whole. So if someone has a lot of excessive demand, if they can show that they can cover those costs on their own, and maybe perhaps other factors as well, then they might still be able to be admissible.
Right.
So it really depends on the whole context, and usually the IRCC will actually send a letter and let them know what the reason was, and even give them a chance to respond and address those issues. So it's a very transparent system in that regard.
And how does the exam process differ for children than adults compared to adults?
The main thing for children is that, and thankfully, there's less, like they don't have to do a blood test. So anyone under age of 11 essentially doesn't need to do an X-ray or a blood test.
But like things like, for example, I'm not 100% sure, obviously my medical knowledge is limited to Grey's Anatomy, but like certain...
Grey's Anatomy is quite a lot.
Yeah, but certain cancers are found through like blood work, and sometimes like not even some kids do have cancer and things like that that require a lot more treatment. So how would you detect those things?
So in fact, even for adults, when I mentioned that when we do the blood test, we actually don't look for cancer in the blood anyways.
Yeah.
Usually if there's like majority of the times if someone has cancer, they would kind of know, because it would make you feel very sick. If it's sort of to the level where it hasn't really shown itself yet, then a lot of times there actually isn't any tools anyway to look for cancer. So it's mostly, long story short, it's mostly kind of looking for existing and known issues, and looking for the things that are a little bit more obvious, and also based on what the patient also reports to. So it's not having the blood test for kids. Like for example, in the blood test, we're looking for like kidney function, we're looking for like HIV and hepatitis, and a lot of times it's less likely to find those in kids that are being known.
Okay.
Yeah.
Yes. And then can you appeal the results of an immigration medical exam, and how is that process like?
As I mentioned, there is a specific letter. Actually, I think I might have written it down. So it's actually called a procedural fairness letter that the applicant will be sent, and will sort of have the reasons why there's any issues with their medical exam, and we'll give them an opportunity to respond. Right. So if there's more context to it to show that they're looking after it themselves, or that it's already been treated, or whatever the case may be, so they have a chance to appeal that and address that as well.
Okay. And what's the most surprising thing that you've seen or heard during a medical exam?
I think the most unique thing and that's surprising is sometimes when I find, especially with spousal sponsorships, when Athletic K is sponsoring their spouse, sometimes they'll volunteer how they met, especially if it's from an otherwise random country. And some of those stories are quite surprising and interesting. Like sometimes they'll meet each other like online playing video games, and be connected. And
what video game? In case they want to know.
Yeah.
To meet your spouse.
You know what? I haven't asked before, but I'll definitely ask next time.
Yeah.
So that's surprising. Or sometimes they'll meet their spouse. Like I remember, I had somebody sponsoring a spouse from New Zealand, and I was so surprised because I was like, most of us Canadians are trying to move to New Zealand. Why are you, getting sponsored here? And they said that they had met their spouse like skiing in Banff. They just met each other there. So I think some of those stories are kind of interesting. And definitely, I think everyone, even certain refugees, sometimes will do an X-ray, will find like a bullet round in there or some shrapnel, and they'll tell the story of like how it happened. So definitely there's some cool stories and based on where people are coming from or how they ended up migrating to Canada.
Well, it's really interesting. But thank you so much for sharing all the insights on the immigration exams and how they're done and everything behind that. I feel like that's such useful information that people don't really know before they're about to come to Canada. So thank you for taking the time to do that with us today. And Dr. Furmli will be back to do more videos, hopefully, and more podcasts with us. So comment what you guys want to see next and what you guys want to learn about next.
Thank you for having me. Thank you, KNPR.
You're welcome.
And